Hello, my name is Dr. Tedlawalde Georgis, and I'm an advisor to the Federal Ministry of Health. And this is a brief documentary on mhGAP, which is being carried out by the Federal Ministry of Health, which is supported by the World Health Organization, the European Union, and Fondation de Harcourt. mhGAP is a project that's designed to scale up mental health services by integrating it into the primary healthcare system. And by scaling up mental health services and integrating it, the idea is that it's going to provide services to the wider population. So different people who are involved in this project are going to tell you a little bit about mhGAP project. Enjoy.
WHO launched the mhGAP program, which is to scale up mental health care and to reduce the gap between the services and the needs. We had the mhGAP IG, which we launched in 2010, and we're very happy that the government of Ethiopia has adopted this program and is implementing this in several districts with very good progress being made. WHO is very pleased to provide support to the government of Ethiopia with a strong leadership which is supporting the implementation of this program in the country, and we are extremely happy to support them in training primary care doctors, nurses, and to help them look after these disorders under supervision of a specialist. I do want to emphasize that this is a long-term process, but a good beginning has been made, and we expect that in the next few years' time, all the people in Ethiopia will be able to access services within the general healthcare services for their mental, neurological, and substance abuse disorders.
I have to say that myself, I like very much that idea just to work on mental health, because that's something we don't do usually. We focus on health services, immunization or whatever, and we just ignore or neglect that aspect of health. And I think that's important just to have that starting point, and with a reasonable small amount, just try to get a big impact.
This is actually a 3-year project that involves 2 countries in Africa, Ethiopia and Nigeria, which is co-funded by the Fondation, which is a Geneva-based foundation, and the European Commission. This demonstration project is being conducted in specific sites of selected regions of Ethiopia, namely Tigray, Oromia, Amara, and Ethiopia. And we are also replicating the same project in Harar and Redwa, regional health in Harar and Redwa from our regular budget. The implementation phase of a mhGAP project has involved conducting series of trainings for non-specialist health workers in these identified health facilities of selected sites.
I have been here now 4 or 5 times, and on every single occasion, all mental health leaders have been strong advocates for decentralization, making care available in the rural areas. And that is really a very unique situation. That's why Ethiopia is so well placed to do this program, this mhGAP program.
We have started our work in mental health in Africa a few years ago. We are in 5 African countries. We are also supporting initiatives in mental health in Middle East and Europe. But this partnership that we have with WHO and with the Ministry of Health of Ethiopia is unique, because for the first time our foundation had the opportunity to be included in an action that is an intervention at the system level, with a strong engagement and technical advice of the Ministry of Health.
Here at the Federal Ministry of Health in Ethiopia, we just developed and launched a 5-year national mental health strategy, and this is what it looks like. I believe that the mhGAP program or initiative has a lot to contribute. because it provides us with excellent training materials, with diagnostics algorithms, actual training packages, and evidence-based practices that's going to enable us to integrate mental health services into the primary health care level. Therefore, we're really truly grateful at the federal ministry that Ethiopia has been selected as one of the 6 countries to implement mhGAP.
Manuel Specialized Mental Hospital is the only tertiary level psychiatric hospital in the country. It is one of the oldest hospitals in Ethiopia, and it was established in the 1930s. And first it was serving as a detaining center for the violent, mentally ill. Then it served its purpose for some time then as a restraining area, and over the years it has evolved now from just a detaining center to the now tertiary level psychiatric hospital. One of the main goals of the hospital is to help and lead in facilitating the decentralization and democratization of mental health in Ethiopia. And to this end, we believe that the mhGAP program is well aligned to the hospital's objectives. And that's the reason why the Minister of Health has also delegated the hospital to lead mental health gap action program. And there is a core group which is being chaired by the CEO of the hospital, with members coming from different stakeholders, including the psychiatry department, WHO, the Minister of Health. So far, the activities that have been done in the mhGAP are the training of different health workers at primary care level health facilities in 4 selected regions, which includes a base course and standard course training, and supervision and mentorship have been given by the psychiatrists from the regions, and also health professionals going from Emmanuel Hospital. Different workshops have been also conducted in the regions that involved the regional health bureau administrators, leaders, and decision makers and other stakeholders. We hope that the different stakeholders that have been contributing so far, including WHO, Fondation, the court, and the European Union, will keep on helping us and contributing to make this possible.
WHO has produced an mhGAP intervention guide consisting of 10 priority conditions with evidence-based guidelines to detect, assess, and treat what are called priority conditions. The intervention guide was contextualized to Ethiopia, and training materials were developed accordingly. 2 sets of training materials were developed, in fact, what in the mhGAP jargon we call base course and standard course. Non-specialized health workers are trained initially on a base course. After that, they receive mentorship and supportive supervision, and after that they are trained on standard course, so that our training has the shape of a sandwich with training, supportive supervision, and training again.
The Program for Improving Mental Health Care, as well as known as PRIME, is a cross-country study involving 3 African countries, Ethiopia, Uganda, and South Africa, and 2 Asian countries, India and Nepal. It also involves several cross-country partners, mainly WHO and Center for Global Mental Health. PRIME will produce evidence based packages to support mhGAP in the integration and scale-up of mental health care. And Prime has 3 phases. In the first phase, it develops packages that are linked with mhGAP and support mhGAP. In the second phase, it implements those packages that are again linked with mhGAP and supportive of mhGAP. And in the third phase, it scales up those packages that are informed by mhGAP as well as by its primary evidence.
It was quite impossible for in area where a very limited number of psychiatrists are available, just like the regions that we are here. Oromia, we have only 1 psychiatrist and very limited psychiatric nurses and mental health professionals. So the contribution of mhGAP is, with this project, we were able to educate, train non-mental health professionals in the surrounding health centers. So in the health centers, we trained them. Previously, they were not detecting and managing mental health problems. So with this project, they were able to get the training, they were trained. So because of the project, they were able to detect and manage mental health professionals. So generally, the mhGAP has a great contribution. That is the big question in developing countries to decentralize psychiatry with very few limited number of mental health professionals. So mhGAP has contributed a lot in decentralizing psychiatric service in this region.
mhGAP ሰልጥኛ ያገኘው ትልቅ ጥቅም መጀመሪያ ከማቀው ሞር የተሻለ እውቀትን አግኝቻለሁ። መጀመሪያ mhGAP ለወይንም ደግሞ ሜንታል ሄልዝን በትንሽ የክሬዲት አወር ወስርነው ሞር ደግሞ መድኃኒት ላይ ማርለም ትኩረት የምናደርገው ሪፈር ነበር የምናደርገው ወደ ሆስፒታል። አሁን ግን መድኃኒቱንም ሁሉንም ነገር ስለተማረን መድኃኒቱንም መስጠት ጀምረናል። ካቀማችን በላይ ሆነን ደግሞ አሁንም ሪፈር እናደርጋለን።
Thank you for watching, and I hope you have learned something on how mhGAP is being implemented here in Ethiopia. And if you want additional information on mhGAP, please contact us on the following address.